Please.
Australia has one of the best healthcare systems in the world. We have some of the best health professionals, the best health researchers and some of the best facilities. But all of that counts for nothing if Australians can't access the healthcare system. And this begins with seeing a GP. If you can't get to see a GP, you can't have minor concerns resolved. You can't get a prescription. You can't get referred to a specialist. If you can't get to see a GP, the health system is basically Google and a pharmacy. Access to GPs is absolutely critical for the health and well-being of Australians. But for the residents of Wentworth, access to a GP is becoming increasingly difficult and expensive. This affects everyone, but particularly lower-income residents. Those members of the community depend on bulk billed services. They can often not afford out-of-pocket costs, especially if they need regular consultations. So many residents raise these concerns that I asked my team to survey clinics in the community. The results were deeply concerning. Of the 49 GP clinics in Wentworth, just 4 offer exclusive bulk billing services. Another 20 offer mixed bulk billing and full fee services, but 5 of those told us that bulk billing was only offered at the doctor's discretion. A number of others have restricted eligibility, such as limiting access to children or pensioners. This really worries me, but I'm worried that this number is also shrinking rapidly. So far this year, at least 7 clinics have shifted from being bulk billed to mixed fee practices. I know others are considering this. But most worrying is that if some of the GPs who offer bulk billed care at the moment are nearing retirement, when they go, they may know there not be another GP to replace them, certainly not one who bulk bills. For those who have to go to full fee clinics, the out-of-pocket costs can be significant. Half the clinics charge patients between $50 to $80 for a standard consultation. Many charge more. And at least 6 clinics have already raised their fees this year. Many will follow. I have spoken to local GPs about this. They understand it makes it difficult to access care. But they say it's not viable to operate bulk billed clinics anymore in Wentworth. What they receive from Medicare is not enough to cover their costs. And at the same time, we are facing an acute shortage of GPs around the country, an acute shortage of GP training. This is fast becoming a crisis for Wentworth, as it is for communities all around the country. I have shared my concerns directly with the Minister and urge him and the government to act on these concerns urgently and ensure that Medicare remains the effective, respected and accessible system it was intended to be, and that we are training and developing and retaining the GPs we need to meet community needs. Thank you very much.
Thank you.